How's everybody today? Excellent. I know you're all enjoying the hope and change. It just gets better by the day. Kelly talked me into doing this lecture in August, which there's some really cool stuff on this topic. Really interesting things. It'll be kind of a shocking lecture because genetic engineering really doesn't have any place better than minerals control the genes. This will be a very deep lecture for people about how important minerals are for genetic expression. And this really throws like a monkey wrench right into everything that you're seeing in the paper. Just kind of, you'll find this to be interesting, and it's sad that this is expressed more in the animal industry than in the human industry. That's right, I got that. Dr. Jeff has a great lecture coming up on Toxic World, Wednesday, May 29th. It's going to be at the Sheraton. And he does a great job with these lectures. And it's hot in here, isn't it? See if they can cool it off a bit. Or are you cold? No. Okay, no, I'm not either. Wednesday, May 15th at the Novi Library, there's going to be a preview of the movie Doctored, which has really made the rounds around the health community. Sign up. It's free. You ought to enjoy it. And it's really an eye-opening DVD. My son opened a business at 6 Mile and Middlebelt. After graduating from CCS, he's right now wrapping a GTR, which for you car guys know what a GTR is. It's very interesting to watch what they're doing over there. And I would, if you use people around here know the old Shooter Service Building. How many people in Livonia know where Shooter Service is? It's the old Shooter Service Building. He's doing some really cool things there. And he opened, and he's a CCS graduate. He's doing real good, so I didn't even know that slide was up there, and I'm glad that they put it up. Our website for Diverse Health Services. We have a monthly newsletter. The patients and their friends, they're shipping information. I would make it easy for you to do certain things that we talked about, and for the patients, because I have a patient, base that isn't necessarily right around my office. I've Skyped with patients now. That this YouTube thing has opened a can of worms beyond. I've Skyped with about every country, locally all of a sudden. It's been kind of eye-opening. I really did not expect or want this to get this big, but it has really grown ridiculously beyond my wildest. After 32 years in practice, I was looking for a little easier road, and I ended up getting a harder road. And you should see that autoimmune lecture, that the Skype's coming from that. So the website, diversehealthservices.com. Doctors, I had a doctor yesterday with that autoimmune issue from California. He's been sick with that virus forever, and he said, look, you have to write a book. You have to start educating all us doctors out there because nobody really understands this topic yet. So it's been quite interesting. Before It's News is a great website. They put my lecture on it. A doctor's website, Green Med Info. That's a huge doctor's website. I think it's on 15 different websites. It has gone absolutely around the planet. Lou had a call from a guy recently from New Hampshire that said, I think you should have somebody start this guy's car. That's what I got Lou for. That's what I got. Jenny McCarthy, if you know her story, she was getting her and Jim Carrey were sitting there and they gave their kid a vaccine. And the kid collapsed in her arms. She became a real warrior about vaccines because as the kid collapses in her arms, she's like, you just messed up my kid. And he's like, it was a coincidence. She's like, no, you just messed up the kid. So they tried to convince her it was a coincidence. She didn't listen well. She's been quite an advocate. And she picked up that autoimmune lecture and sent it all over Hollywood. And I've had some of my son's friends watch that lecture because they are on Jenny McCarthy's tweet account. So, paging all mother warriors and daddy warriors, please watch The Exploding Autoimmune Epidemic. And one of the comments was, brave soul to speak the truth, amazing. That was kind of... All right, Kelly.
Do you know what you're buying at the grocery store? Chances are you don't. The U.S. government has refused to allow reasonable and common sense labeling of foods that have been genetically modified in laboratories. As a result, an estimated 80% of processed foods in America contain GMOs. In 2007, Barack Obama promised to make GMO labeling a priority.
Here's what I'll do as president. I'll immediately implement country of origin labeling because Americans should know where their food comes from. We'll let folks know whether their food has been genetically modified because Americans should know what they're buying. We'll let folks know whether their food has been genetically modified because Americans should know what they're buying.
We agree. Now is the time to label genetically modified foods.
Obama sells out to U.S. citizens by signing the Monsanto Protection Act into law. How many people are aware that that was just signed? So no matter what the food does to us, they are totally exempt from selling us toxic food.
11 established now voted for that too.
Absolutely. So we'll get into some interesting things. So no matter what happens, you can't hold them accountable for anything. I know some of my veterans know about this, but some haven't. And as I was going over the lecture with Kelly today, she made the comment to me, I can't believe how smart our founding fathers were. I can't believe, because today you're seeing a sea of, you know what it's like to drive down the road? Unless we put medical freedom into the Constitution, the time will come when medicine will organize an undercover dictatorship to restrict the art of healing to one class of men and deny equal privileges to others. Will be to constitute the Bastille of medical science. Look up Bastille when you get home. All such laws are un-American and despotic and have no place in a republic. The Constitution of this republic should make special privileges for medical freedom, here's the kicker, as well as religious freedom. Now, they're forcing me and you to buy insurance for a system I personally don't want. And the point of my story is, religious freedom, I'd keep a real close eye on this one, because that one is going to be next. Amazing, I passed out a website, amazingdiscoveries.org. Watch Walter Veit, V-E-I-T-H. He has some very interesting documentaries that are free. Total Onslaught, Rekindling the Reformation, and Repairing the Breach, because this country is going to be blindsided by the changes. And you're not going to see it coming unless you're up on it. Dr. Oz, you know how many people ask me about Dr. Oz? Do you know, you have, you know, it's kind of interesting to watch the medical industry go along, because watching them do stuff to people that they wouldn't do themselves, I find that interesting. Passing out shots to the kids that they don't give their own kids. He totally trashed non-GMO'd foods in this article, called it a snob. He said they were snobs. This was very, very interesting that he promoted feedlot beef, conventional ice cream, and canned foods while applying organic foods are elitist. Foods only for the 1%. And it's kind of interesting that he was asked about vaccinations. He said, you can find this on YouTube. Do you believe we should all get vaccinated? He said, yes. Even the children. He said, yes. They said, do you vaccinate your kids? And he said, no. Who, especially my Second Amendment supporters, who would like an early Christmas present? This is an early Christmas present, courtesy of Dr. Oz and our special Englishman.
Because I'm about to have my first ever flu shot, and I thought I couldn't get a better guy than you to do it. So the myth about these, and I'm told it's a myth, is that you can actually get flu or flu-like symptoms simply by having the shot. Is that true?
You cannot get the flu from the flu shot because the material is actually dead flu virus.
Okay.
So it cannot cause a problem for you. It's based on whatever virus was present in Southeast Asia a few months ago.
Okay, so that is a myth.
That's a myth.
Okay. You've got a very large needle.
I love this part.
You're
This
enjoying
is
this,
literally the biggest needle I could find. There are none larger. Please give me a muscle.
Okay.
That's it?
Mate, that's the biggest muscle you've seen for a while.
Look. All right, that's it. That's it. 1, 2, 3.
Oh,
and
blood.
Please.
Oh.
Not even bleeding. No blood even, please. I'll give you a Band-Aid so you don't cry.
Okay.
It's
like a dull ache, really, isn't it? It doesn't really hurt.
It doesn't really hurt, and it's about the size of a mosquito bite.
Should children have them?
It's recommended that after the age of 6 months that we give it to our kids. And frankly, it's much more valuable in the really young and the really old. But it's particularly the older folks who get the flu, and then they have heart attacks related to it. They get all kinds of complications related to it. So listen, it's one of those smart things. In life, there are some things that are predictable. There's some things that aren't. This is one of those events that I think can be beneficial with very low side effect. I mean, we've got 130 million of these little vials out there waiting to help people with. Let's take advantage of it.
If I get flu now, I'm coming after you.
If I get the flu, I'm coming after you. This is always the kid that I would have beat up in recess. Yeah. He's a kid. He wouldn't have lasted in recess. We'd have taken care of him about the first week. Okay, next 10 days later.
25 million records, Dwight Yoakam is much more than a country superstar. He's a talented actor with a lot to say about issues that matter to America. Dwight's latest album is 3 Pairs. Welcome to you, Dwight. Before we go any further, you're a singer.
Yeah.
You must have had sore throats over the years.
I hear that. Well, you know
As you
what?
can tell, things are deteriorating. Is there any advice you can give me?
Don't ever take a flu shot again. Now, I watched that night with Dr. Oz, and in deference to Dr. Oz, I think he's, probably, he seems like a completely competent doctor. And I don't understand any of the, the kind of biological aspects of the, of the meds that.
But we're both doing the maths, aren't we? We both saw him put that thing in my arm, and
Yeah.
within 10 days, I've been struck down.
I you know what? I don't want to tell anybody out there. I'm not a medical advisor. Get your vaccines if you. I don't believe in them. I'm just suspicious by nature, and I saw you get it. And here we are.
Well, let's try. We'll try and plough on with the interview, notwithstanding the fact I can't speak.
Yeah.
It couldn't have happened to a better guy. Piers Morgan. Now, they said, after the mercury and the animal viruses, that the season's flu vaccine was almost completely ineffective. Now, you've seen that, right? It was completely worthless. They said it really didn't do anything. So, I want to ask you a question. This world's getting stranger by the day. They told you the young and the old had to get your shots, right? And they said it wasn't effective. Was it? The season's flu vaccine was almost completely ineffective in people 65 and older, which could explain why rates of hospitalization and death have been some of the highest ever recorded for that age group. They died. Was it effective or wasn't it? I'm asking you, how interested are they in keeping the seniors? And remember, you guys are the ones why we're all fighting out there that actually call your senators and congressmen. I'm telling you, the Republicans and the Democrats have absolutely pushed this country. The Republicans started the mess. The Democrats wanted to make sure it kept going. So keep calling your people, stay on your toes, because things are heating up. This lady was in Friday. Chronic low back pain when sitting. When she stands up, it goes away. Also has constant burning pain, pins and needles in both legs and feet. She said it's absolutely symmetrical. It's perfect. Goes right down my spine, goes down both legs. It's perfect how this expresses itself. It's exactly the same on each leg. She's been to absolutely everybody: MRIs, CAT scans, neurologists, EMGs, vascular tests, skin biopsies, physical therapy, chiropractors, everything. And I walked in, listened to her story, and I said one thing to her. One. You got that button? I said, you got a bad flu shot. She gets flu shots and pneumonia shots every year for the past 8 years. I said, you drew the hot lot. And she said, you're kidding. I said, no, that's what it looks like to me when something's attacking the spinal cord. So she looked at me and she said, well, I sent her out for that viral panel on the autoimmune lecture that the whole world wants me to teach this, because you're having to walk into every room with these patients with lupus and all these weird autoimmune diseases that don't make any sense. So she's walked out of there. Not only did she get a bad flu shot, then they put her on Neurontin and a statin and a blood pressure pill to weaken her legs any further, and she's very frustrated, and I know she's walked out puzzled. Remember, I said to her, and I said this to the doctors, remember, when it doesn't make any sense, what did the doctors do last? I said, does this make any sense to you? She said, no. What did the doctors do last? I always go back, and that's what I train the young doctors, track their history. They're going to tell you what they got themselves into. Now, when they started to tell you this year that, well, it was the H1N1, CBS reporters filed a Freedom of Information Act lawsuit to find out why they stopped testing the flu, because more than 90% of the cases weren't H1N1. They tried to tell you, well, we nailed this. No, they didn't. They missed it by a mile. So they stopped telling you about it because they knew, once again, viruses will mutate faster than they can keep up with. Never going to keep up with. I wanted to put this out of the lecture, and Kelly said, no, you got to do this one. Kelly overruled me on this slide. On my hockey league, I'm either the Gatorade, water or Gatorade is what you're going to get in the locker room. Everybody's drinking beer. I'm the Gatorade water. They either get me Ice Mountain spring water, which I don't like, or they get me low-calorie Gatorade. So I walked back in the room, and they said, we were talking about you after they found all this flame retardant in the Gatorade. And that was a big thing in the news. I said, not only is it flame retardant, I said, you guys got to get the NutraSweet added flame retardant in the Gatorade. And they said, what's wrong with that? I said, well, you would have never had NutraSweet if it wasn't for Donald Rumsfeld. So here's all these guys. It's an over 40 hockey league. All these tough guys in there. I mentioned flame retardant Gatorade and NutraSweet. Now Jerry, our coach, stands up those two comments and said to me, do you have a bunker at your house? I just laughed at him. I said, you think this? They don't know me. I said, so you think this warrants a bunker, what I just said? So I had him, I emailed him my autoimmune lecture, and he sent it to the whole team. I said, let me show you how far the rabbit hole really goes if you think this really is pushing the envelope. Do you have a bunker? I said, I am front and center. I am not hiding in a bunker. That was funny. Do you have a bunker? This has been an interesting year because how many people watch people get sick and not able to get better this year? This has been a bad year. This is one of the worst years. Most everybody missed it. My whole family missed it. Most of my patients missed it. The ones that got it got creamed. Absolutely creamed. They called it, some patients came in, they went to the hospital. The hospital said, you got the 100-day cough. You're going to cough for 100 days, and there's nothing we can do for it, and that's just, how many people had it in this room? Raise your hands. I'm talking not a simple, something that lasted. I've had them come in with confirmed viral meningitis, that cough that they cannot shake, and I had healthy patients get this, not the sick ones. It was brutal. This was a brutal year, and they know it's coming. A new wave of superbugs. Now, there's a slide that I lost something putting this together. The last antibiotic came out in 1987. Now, that was the last one. They have absolutely nothing, zero, for these strains that are out there right now. And the point is, it costs $1 billion to come up with a new antibiotic. It takes 10 years, and by the time it comes out, it's obsolete. So they just basically told you, you're on your own. Remember this, every year with all these infections, you're on your own because they're mutating faster because of the stuff in the food than they even are trying to keep up with. They quit in 1987. Lou, are they still turning the air on in here? It's hot. See if they find what's his name to fix what's his thing. So I'm just in the fall. I'm gonna, for the first time. Now I don't get this stuff because I work at it hard all the time because I can't afford to get sick. I have absolutely. People say, "Am I contagious?" The people that come in, "Am I contagious?" I said, "For Pete's sakes, they're hocking and spitting over me all day. If contagiousness was real, I'd have been dead 30 years ago. This contagious thing is old-fashioned stuff." So I'm going to talk about immune promoting things at the August lecture because you better work on your immune system because this year train wrecked people. It was brutal. Some surprising patients got sick and they couldn't shake it. They had to let it run its complete course, and I'm basically keeping people alive just so they can fight the infection because it's that bad. Huge problems. The CDC sounded an alarm. This was in the USA Today. I'm sitting at lunch reading the USA Today, and I sent it to Kelly, and it was kind of funny. Neil Fishman, Associate Chief Medical Officer at the University of Pennsylvania Health System, said they're going to have to use old, outdated antibiotics that can damage the kidneys because safer ones no longer work. Now, I want you to picture something. Dr. Tent, crazy person from Novi, wants to put somebody on Congoplex. Now, when I put you on Congoplex, I have to ask a question. Do you want a toxic supplement and end up on dialysis, or would you prefer to have a limb amputated? That's what Dr. Neil Fishman asks his patients because the antibiotics don't work, so now he's got to use the stuff that'll either kill your kidneys or you have to chop off your arm. How would you like to go in and be given that choice? It's unbelievable. Absolutely unbelievable. But that's not craziness. It's the people in natural health. That's what's crazy. It's unbelievable. I get a kid. This. When I go someplace and they say to me, getting stuff from my father and stuff, "Do you have a CVS card?" And I say, "No." And they go, "Can I do this?" And they disrespect me because I don't have the card. Do you have a, Rite Aid? Do you have a... And you see some people, and I understand why people do it. They offer discounts and stuff. I really don't shop much, so I don't really have to, get this little discount. But it's funny when I say no, and they look at me like I'm nuts. Well, now the insurance companies are going to buy all the stuff that you purchase, and they're going to base your rates around your grocery purchases. So the insurance company knows what you ate. Well, you drank this much booze, we're not going to cover your liver. Well, you bought all this candy, well, now you're a diabetic, we're not going to cover you. So all those cards, which I knew they were going to do this 100 years ago, so enjoy when they say, it's kind of funny. When you walk into the, I'm always in the drugstores picking up stuff from my father. And you walk in, and a nice little happy lady walks up, would you like a flu shot? And I was prepared to tell them, and nobody's asked me that, probably because I look so unsociable, they avoid me. And I wanted to say to them, I would rather stick a knife in my eye. I wanted to see what they'd say when I said that. I went through the whole year and nobody asked me this question. Please, ask me the question. Ah, yes. I've seen some of you folks, I grew up in a family. I went up north with my relatives in Vanderbilt, Michigan. I had 4 lumberjack cousins. I was a little kid. They pulled out all their cannons. And they had every kind of gun you could imagine. This was their right arm. I grew up around this. It is not a big deal to me. I don't feel anything scary about guns. The doctors are absolutely, I've asked patients, did you ever know of anybody killed by an assault rifle? Living in Detroit, I don't have murdered friends, people that, are outside here that think where we live, think how dangerous it is. We kind of laugh at them because as long as you stay out of the places you shouldn't be, this is a very safe state. I had a sheriff in Monday night with him and his wife. I asked him, how much trouble have you guys had, he's my age, with concealed carry owners? And his answer was 0. Absolutely nothing. Not kind of, nothing. Now, there's a question. Kelly did a great job today. I said, Kelly, I want you to look something up for this lecture, for this topic. Are you paying attention? Cyprus. They started out at 5%, then they went to 10%. Now they're just going to take 60% of your savings account. 60%. How many people have seen this on the news? Italy said, that's a good idea. We should just take, we could do the same thing. And a bunch of countries are picking this up. Now what's interesting, the central bank says 37.5%. Another bank said, no, it's going to be 60%. So that they can get another loan that they can't pay back. This is the game. You loan a country money that you know they can't pay back, then you steal their resources. You steal the trains and you steal the roads and the casinos. That's what they were doing in Greece. They were dividing up the country. So what's interesting about Cyprus? Cyprus has strict gun control. So when they come and steal all your money, what are you going to do about it? What are you really going to do about it? I know that there's some crazy people in this room, who if you went into their bank and stole their savings, the banker might have trouble getting to his car. And he should. You let them go further with all this crazy gun control stuff, they're going to steal the money right out of your account. And there's nothing you're going to do about it. You're going to thank them for doing it. Why do you think Raggedy Ann looks like this? Anybody have a Raggedy Ann doll? They had little X eyes, just like that. I never knew why. Why do her eyes look like that? She looks dead. Okay, so Raggedy Ann looks dead. So a lot of people bought their kids a little doll that looked dead. Marcella Gruelle, daughter of children's author Johnny Gruelle, died after receiving a smallpox vaccination without her consent. After Marcella's death, Raggedy Ann became a symbol for the anti-vaccination movement. That's what it really meant. That's why she looks dead, because they killed her. Now, first of all, my kids, I have one of my children here. Do you know how absolutely sick of this topic I really am in my kids have never been to a pediatrician. I have very healthy children. I'm so sick of this topic, but I have to bring this up because they're tightening the noose around my patients, their children, and employment. So, autism has skyrocketed 1,000%. So believe me, I'm absolutely, totally burnt out on this subject. You ready? In 1 week, I had 3 people in that I was talking to. Right now, at Novi High School, that's down the road from the office, how many special ed kids you think are in Novi High School? 145. There's 145. I talked about Dylan. I'll tell this story for Dylan. Are you paying attention? Okay, just making sure. Dylan, he heard me say a story. I said, when I was growing up, there was this kid named Roger. And Roger was in a wheelchair because his dad ran him over with the car in the driveway. So I always remember looking at Roger thinking, holy Toledo, he's a mess. Now, when I go out places, I see these kids everywhere, and nobody hit them with a car. And they look like they've been hit with a car. Now, how bad is this? Macomb County, 20,000 students in special ed, because they're all screwed up. 20,000. Wayne County, 47,000 kids. 47,000. Oakland County, 24,000. That's 92,000 kids in 3 counties. The schools get paid more, and the doctors get paid more. This is a catastrophe. That's 3 counties. Now, if you looked across the country, we can't afford this. And nothing's worse than these messed up kids' parents come in, they're 70, they're 75, they're trying, what do I do? I have people that have had 3 of them by the time the doctors got done out of 4. What do you do with your kids? What are you going to do with your kids? Where are you going to put them? They're just all screwed up, but they're not going to die anytime soon. What do you do with your kids? And every time this happens, one parent quits their job to stay home. Now you lost that income. That's a mess. And the parents will give you a 90% chance they'll be divorced in 10 years. 90%. You know, people ask for permission to do stuff. Raising kids to the system was so easy, I'm amazed how hard you folks have made it by asking them for permission to do stuff. You don't ask them for permission. I told them what we were going to do with our kids. My wife was absolutely no pushover with you. Dylan remembers up at Camp Asabo when the nurse asked her why we didn't have shots. My wife leaned over the table and looked at her and said, "We don't poison the children." He got his application stamped. Move along, ma'am, move along. Simple. It wasn't up for debate. We weren't going to negotiate about this. It's, have you lost your complete mind? Ah, yes, this gets better. Who's the president again? What's his name again? Barack, Osama, something, Obama. A presidential ethics panel has opened the door to testing an anthrax vaccine on children as young as infants. A presidential ethics, they call it a presidential ethics panel. So now they want to test anthrax on the kids. Of course, that makes perfect sense to me. I don't have, is this real life, Kelly? Is it? We're going to get to the is this real life soon. Everything here is referenced. It's really getting sad. For my next lecture, I got this messed up kid. I got 100 messed up kids. They're so messed up, I don't even, just walk out of the office, just walk out of the room, just shake our heads. We had a special one today. I don't even, oh, did we have a special one today? I don't even know what to do. There's beyond help. So Grandma, I got the one messed up grandson. Grandma says, can I talk to you for a second? I said, yes. My other grandson is taking apart his bike and eating it. Really? Didn't you say something about minerals? I said, yeah, pretty much. He's really missing something. If he's got to eat like the sprocket or something, he's really not doing well. So I had a lady come in. It looked like, I don't know, if I looked around here, it would look like she was perfectly normal looking. Might look like you. You're semi-normal. You're with him, though, so that's a problem. I walk into this room. What's the matter? She said, I eat 22 ounces of talc a week. That's normal. I only eat 4. That was her. At the next lecture, I'm going to try to pass something around. They've done this on the radio. What's the weirdest thing you've ever craved to eat? And I'm going to send around a sheet to the next lecture. We're going to find out the craziest thing you've ever craved to eat. You should hear the list. Cat turds, string, rubber band, glue. You would not believe what people eat because they're so deficient. This kid wanted to eat his bike. And Grandma starts crying. I'm like, maybe you should just go home and shoot him or something. I don't know. What do you do with a kid that eats his bike? She's 0 for 2 with the kids, too. This poor woman was normal. She remembers when kids were normal, and she's got 2 messed up kids right now. And she can't say anything because Ma thinks she did everything right. They'll both be in the basement forever. Now, talking about some blood work issues. At my age, after 32 years of this assault, I'm looking to fine-tune my body. I take an iodine pill every day, which I just love. I love taking iodine. It makes me feel much more awake. And I wanted to see if I could push my thyroid. Could I push my thyroid harder? Thyroid's a simple thing to push. I'm a 1.6. Now, I've had lots of women come in, a 3, a 3.5. See what the ratio is? I would have treated myself if I was a 2.5 or above. I would have treated myself for that. I would have taken something more aggressive to see weight, ambition, energy, etc., etc. So at a 1.6, I couldn't. That's just too close to being right. If you're between 1 and 2, that's where you want to be, between 1 and 2. Subclinical hypothyroidism associated with 260% increase in heart attack, raises your cholesterol, coronary arteries, and fat cells. You want to make your thyroid run good for 1,000 reasons, and the heart is one of the big ones. When you were pregnant with your special little angel, did your doctor recommend to have your thyroid checked? Children born to hypothyroid women, and that's about 50% of you out there, about half, abnormal visual processing, deficits in attention, as well as sensory motor skills and memory. You want your thyroid running full tilt when you're pregnant. Your kid will be sharper because of it. At 5 years of age, 8 IQ points. ADHD, TSH greater than 2.2 presented lower neurodevelopmental scores as well as a higher risk of attention. Anybody have checked some of their ADHD kids for thyroid levels? That's not done. And you can't go to the doctor because if you go to the doctor, what does he want to do to your kids all the time? It's just I watch these young girls come in and battle the doctor. If you need to get a football physical signed, if you need to get, it is time for that story, isn't it? I was thinking about, what was his name? The kid with the football physical, what was his first name? You know the parents. Huh? Yes. Jeff's kid. So I got this little kid in here. He's 10 years old. This is an unscheduled story. He's 10 years old, and he's in room 6. Won't forget this. And he's in there for high blood pressure. And I treated the parents for years. What do you mean he's in here for high blood pressure? So, are you serious? He's in there for high blood pressure. Okay. New patient. So I said to one of the girls, let him sit there for 10 minutes, go in there and take his blood pressure while I'm working the other rooms. So I walk in, his blood pressure is perfect. I said, your son's blood pressure is perfect. I said, why do you think he has high blood pressure? She said, well, he went to get a football physical, and the female pediatrician was like Rosie O'Donnell. So Rosie O'Donnell walked into this little kid and said, take your pants off. And the kid looked at her and said, excuse me? She said, take your pants off. And he said, I don't want to take my pants off. She jerked his pants down, checked him for whatever she was going to check him for, pulled his pants up, checked his blood pressure, and said, your son has high blood pressure. Is this real life, Kelly? I live in a twilight zone. This idiot made it through school, and I got the one kid pulled away from her. She's got a lifetime practice to mess things up. They don't have a chance. They do not have a chance. I'll never forget that story. Hypothyroid, everything's slow and cold and constipated and depressed. Slow, constipated, depressed, low temperatures, constipation, dry skin, goiter, edema. Hyperthyroid's the opposite. Everything's fast. Fast bowel movements, weight loss, increased appetite, intolerant to heat. Do the opposite. These things are growing like crazy, and these things are tough. They can be tough to do. All kinds of stresses turning people's thyroid loose right now. I want you, now that's a good picture. I want you to watch him on Pawn Stars. That's an example of a hypothyroid to me. He looks dead. Watch him. He moves like he's dead. He talks like he's just dead. And so you watch him. That's what a hypothyroid looks like to me. I wanted to use him as an example. One of my patients comes in. I had a woman come in with a 3.3, and it's a 4-point, different labs use different scales, and she said, look, I have every thyroid symptom, and nobody will treat me because of my numbers. Look at the symptoms more than look at the numbers. Look at the symptoms more than look at the numbers. Look at the symptoms. This lady was running a little hot back in 2008 with her thyroid, so somebody said, stop. Just stop. She's taking Armour, which a lot of people have had success with. There's some processing issues with Armour. They never really were forthcoming with what happened, so they lost some support, but she jumped up to 428 with that kind of a range. You should see how fat and swollen and bloated she was. I had to pound this thing to get it down. I actually pushed it too far down, just to get, all the weight came off and the swelling and the bloated feeling left, et cetera, et cetera. Simple, cheap stuff. Call the office, go to the lab. See, I don't want my records in the hands of the medical community. I have no records. My kids don't have any records. My wife doesn't have any records. We just don't have records. I walked away from that system when I was 13, far ahead of my time to say, these guys are nuts. This guy's going to kill me if I keep going, because I had great insurance. And I've told that story before. Simple thyroid panel. When I started in practice in '81, nobody heard of PSA. They came up with a PSA test, took out all these men's prostates for nothing, realized it was a colossal mistake, and then they stopped and said, don't even test your PSA anymore because the test doesn't mean anything. Have you heard that? You wasted your time, and all these men are walking around keeping the estrogen out of my body. That's the secret. Your prostate loves iodine and it hates estrogen. I work on that all the time because the men today, my staff calls them weenie boys because they've been wienerized. Lois is in the building. I told Lois I was gonna, it's funny, Lois is 90 years old. And you're gonna find the next part about this lecture interesting for the folks that know Lois. 15, 18 years ago, she went through the breast cancer thing. And as time went on, at 85, they said to her, Lois, as now her breast cancer has moved into her lung. So she came into the office. She says, well, I got breast cancer at 85. She's an older widow. They said, now they want to take out half my lung and do chemo and radiation at 85. And she said, I don't think I want to do that. Now, her friend is sitting right next to her in this audience. So the doctor goes out of the room, and the nurse said, I agree with you. I wouldn't do anything either. I said to Lois, well, how's your lungs? She said, well, I'm fine. I said, do you have any trouble breathing? She said, no. I said, how's your appetite? She said, I eat like a horse. I feel great. My body's old, but as far as this kind of stuff, I feel fine. Put her on some supplements, simple things that I take. I'm very aggressive on my cancer part of my body because I don't want to go to that system. That one just creeps me out. This isn't the reason I'm telling you this story. I'm not telling you this story. 5 years have gone by. Now, before I really want to go after this, what's the first question you ask? Because when you go home tonight, Sam Bernstein's going to be all over the TV. How many relatives you have that are going to sue me if we take this journey? She said, none. I said, you got no relatives that are going to sue me? No? All right. And her friend Joan would support me. So 5 years have gone by. I've had her on some specific supplements, whether they helped or not. So here she is. And I said, how do you feel? She said, I feel great. So how's your breathing? My breathing's fine. And I said to her, do you think if they take out half your lung and start chemo and radiation at 85, you'll feel better than you do now? I said, how do you improve on it when you have no symptoms? So now she's 90, 5 years goes by, and she's like, I can't believe this. I still feel the same. Now, the point of my story is, this is the point of my story. She said, you know, over these last 5 years, I've been reading in the paper, in all these journals, how they said this treatment didn't work anyway. That's the point of the story. They're telling you the truth now, because they can't afford the system anymore. Now they're telling you what they should have told you 20 years ago. So here this 90-year-old woman reading the literature goes, geez, they're just really trashing this stuff. Oncologists conceal the toxicity issues and bias. They found out that 2/3 of the trials were so fraudulent, the peer-reviewed journal Nature They found 53 basic preclinical cancer studies. They could replicate 6 of them. 6 out of 53 that they said, this is what you got to do. It was a fraud. And Lois figured that out at 90. Great website, Cancer Decisions. Where am I at? Cancer Decisions, it's a great thing. This guy, Ralph Moss, runs it. You pay $300 for your type of cancer. He tells you what works and what doesn't. It's pretty simple. It's, I hope never have to use it personally, but he reviews all the literature, what supplements, what chemo, what radiation. That stuff works on certain stuff. The thing that they've impressed me the most with has been their lymphoma stuff. I've done pretty good with that. This is for you women. And I don't know if you got tangled up in this in the beginning or not. Health Canada went after and outlawed thermography. They're tightening the noose up because they don't want you using alternatives. So they did a hit piece on CBC News. Now Canadians no longer have access to safe, painless, and radiation-free treatments. This is very important for you women to watch. Mammograms linked to an epidemic of misdiagnosed cancers. Between 30 and 50% of the new breast cancers diagnoses obtained through mammography are classified as ductal carcinoma in situ, DCIS. I've had a number this year. I have ductal carcinoma. DCIS refers to the abnormal growth of cells within the milk ducts of the breast, forming a calcified lesion commonly between 1 and 1.5 centimeters and is considered non-invasive or zero-stage breast cancer. With some experts in Europe does not consider this a cancer. They want to reclassify this as a non-cancerous condition. Here's your research or your literature, the citation from the literature. Now they're telling you what Mike Adams has been telling you for years. Most women diagnosed with breast cancer via mammography never had a cancer problem to begin with. So when you treat somebody that doesn't have anything that does anything, and then you tell them, look how we're winning this war, this is huge. The Europeans do not consider intraductal carcinoma a treatable condition. It's all in the literature. I have some real exercise warriors that have overcome cancer. Conventionally and non-conventionally, you got to exercise. You got to exercise. Remember, exercise lowers your risk for cancer by reducing elevated insulin levels. This creates a low sugar environment that discourages the growth and spread of cancer cells. Sugar feeds cancer. Sugar feeds cancer. You stop sugar with cancer, it'll shrink. Otto Warburg said that 50 years ago, and they finally realized it's the only fuel for cancer. It doesn't eat other stuff. You stop all the sugar, cancer starts to shrink. I've told patients that. Alternative medicine is beating primary care physicians. Every time I see, this is a middle school girl that went to a fast food restaurant, took the ice out, went to the toilet, took the toilet out. The ice was filthier than the toilet. And the point of this story isn't that. It's when people come in sick, they got food poisoning, they got diarrhea, they're pooping blood, they've got colitis. How do you eat? I eat good. I eat good. Everybody eats good in this country. I've never found anybody really that said they eat crappy yet. You all eat perfect. Your food's completely contaminated and poisoned, but you eat good, and I know you do. And it's like I had this little kid in with, Ma brings this little kid in with some kind of nasty leukemia, and he He just looked like he'd been beat up by the system. And as I'm watching him, as he takes his, I don't know what the gum is that he extra or something, he takes out his little NutraSweet gum. I said, "You can't eat that." She goes, "Well, why?" I went to my car and got my Bazooka Joe that I chewed during hockey. Bazooka Joe's it. All the other gum has NutraSweet in it. So here he's chomping on his NutraSweet while he's battling a nasty condition. This isn't real life, is it, Kelly? It isn't. Now they just said that NutraSweet causes diabetes and obesity. You saw that, didn't you? For 20 years later. So 70% of the time, the ice was healthier than the toilet was healthier. Can you imagine drinking out of the toilet? Now, the last time, she's 12 years old. She's 12. The last time, a high school girl, she went for a science project. I covered this. It was in the USA Today. She went to the creek behind her house, took the water out of the creek and analyzed it. She had 40 pharmaceuticals in the water behind her house. And it caught the EPA completely off guard. Everybody's pooping out their pharmaceuticals, and it's in our water. And it's so bad right now that the shrimp are swimming towards the predators. Instead of swimming away, the animals in the environment have been feminized by the estrogens. They're swimming towards their death rather than away from it. Very interesting studies. The benefits of war. War is profitable. And the Department of Energy is trying to rescind a ban so that they can make surgical implants, bicycles, jewelry, zippers, or common household good like pots and pans and utensils from depleted contaminated metal. They have 14,000 tons of contaminated metal. They either got to pay a fortune to dispose of it or they'll sell it to the industry. So I had written down here, get your kids a Geiger counter for Christmas so they can check all their little metal toys to see which ones were made from spent nuclear fuel and radiation. It's going to be fun. After World War I, they had mustard gas. And the principal ingredient in mustard gas was chlorine. They put that in your water when the war ended. World War II had nitrogen-based fertilizers. TNT, that became your fertilizer from the munitions. Now the Cold War is over. They have to do something with the radioactive metal. That's going to be made your household. Every time there's a war, you're going to buy the waste product. Bed Bath & Beyond had to, there's no threat. So your Kleenex holder is radioactive. That's fine. That's fine. Move along, ma'am. There's nothing to see here. Just keep moving. I had to put this one up, and I got a lot of blood stuff coming up. I had to put this up because sick people come in, and they have a whole box of supplements. They bring me the whole box. Unknown to the public at large, many vitamins today are produced through total chemical synthesis, a process whereby a complex organic molecule is synthesized from simpler petrochemical-derived precursors, usually without the aid of a biological process. What this means is that many vitamins are essentially being produced from oil and often sold to the consumer as all natural. When I see this huge box of synthetic vitamins sitting in front of me, knowing how much money they spent on this, I try to finish this and we'll try to put you on some food stuff. Might be a little more expensive, but it's going to make you well, not sick. Here's your hip sockets. This guy walks in. This is normal hip sockets. This guy walks in. He's 52 years old. He's had back surgery. And he was on disability from American Axle. I want you to look at this. There's his hip sockets. You see that? There's nothing. He's grinding bone on bone. Can you see that? There's the space. I put him on 3 things to dissolve calcium and 2 natural anti-inflammatories. About 5 months later, he comes in, his hip pain stopped. I have no idea. I just didn't even want to walk in the room. We're looking at this x-ray. He wants to go back to basketball. And he's really stiff, but it doesn't hurt. He said, can I go back to basketball? I said, you couldn't possibly do any more damage to that. You have no hip sockets. And just the natural things got enough pain out. Hip pain stopped completely, taking supplements. He stopped, and 1 week later it came back. I think he's playing. He'll be the stiffest dude running down the court, but he doesn't really have a lot of pain. It's amazing. High-dose fish oil, some boswellia, and 3 things, the vitamin D, an acidifier, some fast food. Amazing. What do you say about our system? Start a war with the United States. They steal the oil, your commodities, drugs, minerals, and then they shoot themselves. I don't even know I don't know what kind of comment to make on this, because I would try to, I don't know, something has to change, because this is totally unacceptable. Does everybody agree with that? This is unacceptable. 22 a day. Now, getting back to the military, this is why we're broke. This is unbelievable. Kelly and I went over this today. She said, I can't believe this. The Pentagon spent more money on pills, injections, and vaccines than it did on Black Hawk helicopters, Abrams tanks, Hercules C-130 cargo planes, and Patriot missiles combined. It's unbelievable. Now get this. It even gets better. Erectile dysfunction drugs, testosterone therapy drugs. If I got to put the military on erectile dysfunction drugs and testosterone, I think I joined the wrong military. I thought they had testosterone, antidepressants. Unbelievable. What war are we really fighting? Pharmaceutical costs. That's what schizophrenia looks like. And they put an article out that he was on Fanapt, and it was reduced quickly. They got rid of it quickly because they did not want this. That's why today all these shootings are happening, and the pharmaceutical industry got a hold of the media and said, if you like our revenue, you're never going to put in the paper what the kids are taking. That's why it's been all blacked out. So all these crazy people with all these shootings, you will never hear what they're taking, because there's a deal between the pharmaceutical industry and the media. They're not going to talk about it again. It's too profitable to the industry. Is this real life? The UN wants to ban mercury-containing preservative from the world's vaccine supplies. The UN wants to ban mercury. All right. The American Academy of Pediatrics is fighting that ban. Thimerosal has not been found to be harmful. They say mercury is good for you. And removal of thimerosal containing vaccines would needlessly jeopardize the lives and health of millions of children in underdeveloped countries. They don't care about me here. You think they care about the underdeveloped countries? We're carpet bombing them now. If they don't take the shots, we're going to shoot you. This is, it's hard to believe this. Doctors fight ban on mercury in vaccines. And people look at me in amazement. You mean, both of my kids, your kids have never seen a pediatrician? I just laugh. No. My 2 boys are in the back. I'm not running this game. Aluminum. I have kids now whose hair analysis looks like grandma's from aluminum. My kid can't focus. He can't concentrate. Well, that's what aluminum looks like. There's antibiotics. Formaldehyde is a pickling chemical for cadavers. MSG, thimerosal. Everybody knows this causes severe permanent nervous system damage. my son's girlfriend is out there with him. Anytime a person comes in contact with our family, this is not the kind of family that I grew up in. No, this is not the kind of family. We run opposite of the system. People wanted to hear this because I've talked about this in the past. They put so much peanut oil in your kids in the vaccines, that's why your kids can't eat peanuts. They pounded your kids with peanut oil, and pounded your kids with peanut oil, and pounded your kids with peanut oil, so when a kid walks by a peanut, boom. That's why the kids can't eat peanuts. They're full of peanuts. They're so full of peanuts, I had a kid die. One of my patient's kids, who was not a patient, this 19-year-old kid, ate a chocolate chip cookie out of a vending machine. And the chocolate chip cookie was made in a bowl that they used to make peanut butter cookies before the chocolate chip cookie, and he croaked from that. That's why your kids have peanut allergies. Peanut oil, now they're pounding the kids with 68 vaccines, and the more shots they get, pretty soon the body said, I'm not going to take any more peanut oil in my body. You know, I get a kick watching the news when they say something ridiculous about new studies say stuff that happens in a mom's womb has something to do with the baby. No. A new $20 million study says the womb has a lot to... Wow. I just sit there, geniuses. They're just exercise, new research, exercise helps lower the risk of diabetes. I watch these stupid commercials or these news things on TV. They're made for retarded people. Just watch them. Don't just sit and swallow it. Talk back to the TV. Like, this is ridiculous. The womb has a lot. Yeah, it's... When I remember when I had my mercury taken out of my teeth when I used to have teeth, then the dentist said to me, well, you know, we didn't put mercury in. I said, we put this, you know, composite or this glass ionomer. I said, well, you filled my brain full of estrogen instead of mercury. Well, I kind of did. You wanted to try to keep your kids' teeth healthy because this bisphenol A, dental restorations, this is important. This mimics estrogen. Do you think there's a problem with the boys today being feminized? How bad of a problem do you think this really is? It's horrible. I have a lot of girls. My girls come in, these 18, 19-year-olds, track, soccer, volleyball, baseball. They're all little warriors. I'm in cheerleading, I'm in dance, I'm in this. And the little kid comes in, he's all, you know, feminized, and he just plays his little games in the basement. He's pretty. And the girls are the warriors today. This will cross, this estrogen receptors mimic interference, and it will freely move through the blood-brain barrier. You don't want your kids having a brain full of estrogen. It's a bad... It's just, I don't even know. My kids have grown most of their cavities out of their teeth. Dylan will not, I know, he even thinks he's going near the dentist. How many of those did you take in a day before you got near the dentist? Derek, how many have you taken a day? 15. He doesn't want them touching their teeth because they know what I went through because I had good insurance. I have no insurance. My kids are healthy. I had good insurance. I was sick. Can you two guys stand up for a second? Because, Derek, you missed your big intro. That's my son. It opened up Sign City at 6 and Middle Belt. And Dylan's the helicopter pilot. The kids are 21 and 22. And don't they look like I've restricted a lot of like antibiotics and fluoride from them? Don't they look sickly? Those are sickly looking children. I'm a bad father. I've never taken them to the pediatrician, and that's what they look like. They actually have color in their face. The kids that come in the office, they look like they've been dead for about 3 months. I don't even know what to say. What do you think? Oh, he's okay. He's standing up at least. I didn't even know what to say. Especially if you eaten your Game Boy yet? Good. Just eat food. Today we had a prize in today. I'm telling you what. It was a zombie apocalypse today. Some of the kids were in big trouble. Now, ejection fraction. I had to fight the family to fix this woman's heart because the family wanted her on all these medications. They pounded her heart down to 20%, stopped the statins. I got the doctor to stop the statins and the beta blocker, did 3 things for her heart, bounced up to 39%. This should be about 50% at this age. It's not 100. I had to fight the kids to save this old lady because to save, this was Sherry's mother. For you folks that know Sherry, and you know who I'm talking about. Statins, 66% reduction in heart function after 6 months. I can watch this. The average Medicare patient comes in, they're on 8 medications. I stopped the statins and the beta blockers, and her heart responded with the nutrition I put her on. And something I got written down here on that military, all you guys over 50, I'm going to save you money. Assume that your testosterone's low and treat it. You can go get your free testosterone checked, and I'll bet you, if you're not taking nothing, you got low testosterone. What's it like? Do you want to go here? No. Do you want to do this? No. Do you want to go visit your mother? No. They just want to stay home. And sometimes that sounds like me. Check your cholesterol for your thyroid, blah, 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 family history. Let me make sure how fast I'm going to go. Okay. This lady and her daughter comes in once a month. They get their adjustments. They're nice people. Usually one of my last patients before lunch, she wants to have this bunion thing done. My brother wanted to have a bunion thing done. He can run on a treadmill with no pain and wants to get a bunion operation. I said, are you nuts? I said, why? I said, you can run on a treadmill with no, well, if I stub my toe, it hurts. Don't stub your toe. Get coordinated. So I talked to my brother. He said, all right. She decided to have a bunion surgery. So not only did she have the bunion surgery, they took the joint out and put a metal joint in. Okay, 61 years old. All right. So her and her daughter come in. I adjust them both. First a month. Another month goes by. Here she comes walking down the hall with her husband. Now when they bring the whole family, they're all screwed up because that's bankable. That's like this intraductal carcinoma. All the sisters come in to shoot me because the sister wants my opinion, and the sisters want them to take off the breasts, pull out the ovaries, chop off her head, start the chemo. This is my sister. So I can walk in, and the tension in the room, I could feel it before I open. I had to save Dr. Jeff from one of these. One of the girls came, and we're in Jeff's room down at the end of the hall. Last house on the left. That's where we keep Jeff. And the girls came in and said, you better get in there. Those sisters he was kind of young at this time, and the heat was getting turned up. And I walked in, I will not treat your sister because of you. And I made it plain and simple. What do you mean because of you? Look at you. You're here looking for a fight. You're not going to get it from me. Beat it. Done. Now I'm going back to my patients. I could feel it. I know this is too many years of doing this, and I can feel it. So here comes the husband walking down the hall. She had a stroke. All right. Her toe was all. She said, I would never do this again. And now we're talking January 13th. Her toe is still swollen and red from the bunion surgery. So the question is, all right, did she throw a clot from the surgery? Didn't seem to. The toe was all screwed up. She said, the doctor said to her, what do you think? He said, she said, I'd never do this again. Well, this hasn't worked out as well. So now she throws a stroke. Driving down the street, he was there. They were here Monday. She was telling me more of the story. Got dizzy, vomit, had a TIA. All right. Beta blockers and Prilosec don't cause strokes. So now I'm trying to figure out what happened with this. Was her CRP high? No. Her pharmacist told her, stop the Celebrex. That's what gave you the stroke. Her pharmacist saved her. This is a CVS pharmacy at Van Dyke and Romeo. That's how far they come. And he's the guy that gave me the missing link. Celebrex and Vioxx cause clots. So the pain pill, she threw a clot from. And her pharmacist really helped out. Ask him. 47-year-old, 48-year-old. My last patient last Friday. This guy brings in his new girlfriend because his first wife died of that brain tumor from the polio vaccine. His first wife could have been in my lecture. She was a wonderful woman. They carved out half her head and her hair, and it was radiation. It was horrible. I think she was about 48 when she died. It was a horrible. Might have just hit her over the head with a hammer and shorten this misery that they put this little sweet, kind woman it was horrible what they did to her. You know, $300,000-$400,000 to die slowly and horribly. This is his new girlfriend. So she was in my last patient Friday. This is her complaint. Been leaking urine for years. Well, okay. She had a hysterectomy 20 years ago, 2 bladder suspensions. They put a mesh in, and everybody here, I assume everybody in this room has a wiener. Is everybody, men and women, correct? How many times have they shoved stuff up your wiener? You know what she said? I've lost count. Once, twice, 3, 4. We got to go back in. Stick a camera up there. Let's stick a small tripod. And then us keep. I said, don't you think they sprung your wiener? I never thought about that. Well, how many times? It's just a little tiny opening. So they stick a log up there, then Hank comes up there with a broom. And now my dad, the place where my father is, they call me, your dad smells like pee. Because of his insurance, he'd go to the hospital. I said, of course my dad smells like pee. He's had his prostate reamed because he didn't listen to me. He had a lower urinary tract infection one time, and a little bladder infection, and he didn't want to eat, so my mother gave him a chocolate malt from Baskin-Robbins because he had no appetite. That tasted good. Second day, I like another chocolate malt. 3 chocolate malts in 3 days with no food. His prostate swelled up to the size of a beach ball, and he couldn't pee. So he had to go to the hospital. They had to drill him out so he could pee, but then once you get drilled out, you got to get checked. So they checked, and they checked, and they checked. Now my dad just wears a diaper and I said to the nurse at the old folks home, I said, you know why all these people leak and smell like pee? She said, no. I said, they've been catheterized 6 times each, and they sprung their wiener. And she looked at me and said, is that why? I'm living in the twilight zone. Kelly, I've said this 6 times, and David said it the best.
Is this real life?
Did you ever see David Went to the Dentist on YouTube? Look it up. The kid's completely wasted on nitrous oxide, and it's hysterical. I'll bet you there's 10 million. I go through my day, and I've asked the girls, this is real life. So this woman working in the medical industry her entire life, you mean This is why I leak urine? Yes. Yes. It was like a revelation. The choir started to sing. The clouds parted. I don't even know. Stop shoving things up your wiener. So I'm not going to take anymore. I don't know what to say. I honestly don't even know what to say when I'm in the room. High triglycerides. You want your triglycerides half your cholesterol. Okay, this is your ratio. Now, I use a food-based niacin because I get lots of complaints about regular niacin because people get flushes. They get a flush. This gal, 328, she got it down to, where is it there, 147. I think that was Cataplex G. Dr. Jeff has a genetic panel. So he went in, this was his horrible cholesterol and triglycerides. These are horrible. Following some simple nutrition, he went from 726 to 171. I think it's on 10 G a day. Beautiful change in the numbers. Look at that cheesy smile. You can tell he's a chiropractor, can't you? You all got those cheesy smiles. Polymyalgia rheumatica, one of my favorite terms for statin toxicity. I got a lot of aches all over the place. Oh, I got a disease now. I've also seen this used for mono. That's my mono patients. Those are my CMV patients. Statin toxicity is one thing, but those viral patients, this is what they feel like. Their whole body aches. Vegetarian diets, cholesterol, total globulin will frequently be decreased. MCH and MCV will be increased. You know, if you're going to be a good vegetarian, you better, this is a very interesting topic. You need acid, you need B12, you need iodine, you need some protein, and you need some minerals. You're not going to do this strictly on the plants. You're going to get yourself in trouble. It's a great diet, but you got to help yourself. I've had many arguments with these fellas. Here's your clue. MCH and MCV increased, need B12. That's a B12 anemia. Decreased, a B6 anemia. Clues. You know, and the reason I'm trapped doing this is because in my life, people go to the doctor, he runs $2,000 worth of blood. And then the doctor says, well, just get a flu shot and take Lipitor. There's so much information on the blood, nobody gets their blood read. Does anybody ever sit down and tell you that they said you don't even get a call back? And is that true? Am I making this up? They take all this stuff, have no clue how to read it, and put you on a statin and then walk away. It's absolutely, so I'm trapped for the chump change that I make to have to sort out $2,000 in blood work because you're sick, you feel lousy, he got you out of there with a $4,000 bill, I got to read this stuff. This is getting old. Your hematocrit goes up, your blood's too thick. Mine was higher, out of range than I wanted. I sweat out a lot of fluids at hockey. I'm not that thirsty. I have to drink more than I'm thirsty. I have to drink more than I'm thirsty. I have to work at this. My hematocrit was a little bit out of range on that March 17th blood test at Metro. My triglycerides were higher than I wanted. I got my glucose coming down, which was good. That was going up. Now, I have no problem sharing this with you. My father sat out in this lecture for 30 years, okay? Nothing went in his head. You saw him sitting there as if something was going on, blank. A blank slate. He just sat and swooned at his son. He just looked at me, that's my son. There's a gallon of fluoride underneath the sink. I threw it out, he went and got 2 gallons. It was a complete waste of time. My mother told him what to do, and once they wasted my mother, thinking on his own, my father complained. He's at that retirement center. The doctor came in and he opened his mouth. What happened to my father? This is to my brother. This wasn't for you. I'm sharing my life with you because I sent this to my brother because my brother heard the call. Man, he's all crapped up. Listen. Tell Brad how much better you feel on all the medications the doctors have you on.
Brad, you won't believe it. How terrible I felt on all this new stuff that the guy gave me for my legs. I couldn't walk on them. I fell twice in the crapper. And I says, they brought me up to this room here in the wheelchair. I crapped in my pants twice. And it was new and improved. My blood pressure dropped down to 105. It's never been that low. And that's how they were repairing it. Well, what happened is when I came here, they brought me upstairs in a wheelchair. And when I got in here, they already talked to your brother, and then I called Randy, and then Randy made a list. He says, that antidepressant that they're giving you, you're not depressed. It's that crap that they're giving you over there, and it's, he's got to be taken care of. His blood pressure, cut those blood pressure tablets in half, because since he's been on it, he's been weak.
That's a letter to the doctor. I wrote a letter to the doctor where he's at. My dad goes in there. Now, if you see his leg, my dad has polio. He never wanted anybody to know that. He had polio as a kid. He gets this sore on his leg that we've had under control for years. Pulls up his pant leg, shows him the sore. Well, they put him on Augmentin. Craps his pants twice in 2 days. They put him on, and they ask, are you depressed? Yes. My dad likes attention. They put him on Celexa. And they put him on a blood pressure pill. He passes out 3 times. He's laying spread eagle in the middle of the dining room over there at the old folks' home. And they check his blood pressure. It's 105/50. Every time I see him, you should see how low my blood pressure is. These guys really taking care of me here. It never registered. Nothing in this lecture that I've ever done registered ever. Nothing. He just sat and looked at me. There's nothing going on behind his eyes. 2 weeks go by. On my phone, I can find it on the phone, they want your dad to see a psychiatrist for his anger issues. I said, you took an angry white guy and you put him on an antidepressant. He's anxious and stressed. You never put anxious people on an antidepressant because it stirs them up. I went to the nurses where he's at. I said, look, anxiety and depression is 2 different things. My dad's not anxious, he's depressed. My dad says this crap, his exact words, 2 weeks. This crap they have me on is making me crazy. This crap they got me on a pill. He knew they were making him crazy. He said, so when you come in, it's like Monday, one of the new patients Monday, she's 29 years old. And do you know what she's here for? Memory loss. She's been on Zoloft for 12 years, and she's losing her memory at 29. And I went to the nurses and explained this, and this is very easy. They were very respectful, and they're like, man, that's interesting. They're all watching my lectures. I explained to them how the brain works. I explained everything they did. So they made him angry. He pooped his pants and passed out 3 times because he couldn't keep his mouth shut when the doctor came into the room. I said, did you learn your lesson? The less you say, the better off you're going to be. And he fell. This has been a great place. The people have been wonderful. He fell so many times on that medication. They kicked him out, and now we got him in a different spot. And now the new spot's $2,000 more than the old spot. I said, he's got, and John Hancock, he has ARP, Blue Cross, he's got everything. Next. He does not know that we're using this, but without my mother, you'll never see him at a lecture here again. Lowering your blood pressure using drugs, may increase your risk of death. Less is more. Study in the Journal of American Medical Association, when it comes to blood pressure, if I told you how many men tell me, you know, I sure take a lot of blood pressure medication and my blood pressure never changes. I said, say that again. I sure take a lot of blood pressure medication and my blood pressure never changes. Is this real life? Is it real life? I don't think, sometimes I live in a cartoon. How much, when you look at your blood test, one of my friends called me. He's a truck driver up in Cadillac, Michigan. Bill. I have to tell Bill you're on this lecture. Bill felt crummy in the truck driver food, pounding caffeine, feels funny, goes to the doctor, calls headquarters, look, I'm feeling terrible, my face is numb, blood pressure's 235 over 130. So, Randy, can I talk to you? He calls me, he's got my number, tells me the story. He's got to get his DOT physical on Thursday to drive a semi. DOT, those are tough, those physicals. So now he's at 235 over 135. I sent him 4 things. I said, stop the dairy, stop the grains, stop the sugar, because sugar drives up your blood pressure. And you can tell how much sugar you eat. Your uric acid will tell you that. It drives up your blood pressure by inhibiting nitric oxide in your blood vessels. Nitric oxide helps your vessels maintain their elasticity. So when you suppress nitric oxide, all the studies say that. So you'll have a high uric acid when you eat too much. So by question?
When you say sugar, do you mean sugar or carbs?
I would use sugar first and carbs second because it's pretty much breaks down the same thing. So the point is, he goes to his DOT physical and it was 135 over 70. I swear that was by the grace of God more than anything else that he did. It was, you lose your DOT card, you know, you're in trouble. Blood pressure, on that note, I said to the doctor, I don't want to mention his name because he has been to my lectures in years past. I said, look, the old man runs at about 150 over 90. He's laying on the floor at 105 over 50. This ain't going to work. You got to can this. He's not depressed. He's sad. And as we get older, your blood pressure drops. You want it. That's why I said everybody in here falls and leaks. They fall and leak, and you guys have done this to them. For Pete's sakes, you made them all vacant. They're clumsy, they're pale, and they're dead looking. It's the walking dead. And I just said to the nurse, this is what modern medicine has done to these people. They're dead with their eyes open. It's a catastrophe to watch what they've done to these people. Have dementia. Do we have a problem with Alzheimer's now? How many people know somebody that had Alzheimer's? Raise your hand. Everybody. Drugs, cholinergic is a term refers to your memory and neurotransmitters in your head. There's your memory neurotransmitter. Antidepressants, tranquilizers. They had my old man on an antidepressant, a tranquilizer. They're bladder medications and antihistamines. Here's the drugs that suck the life out of your brain. That's what they put the old man on, that one. There's your beta blockers. Here's your blood pressure pills. Here's all your beta blockers, your morphine, your acid blocking medications. All your blood pressure, your antipsychotics, your antidepressants suck the life out of your brain. We have a huge problem. So we just formed, there's a new study out, we're going to start a war on Alzheimer's. Every time we had a war on poverty, more poverty, war on terror, more terror. So now we're going to really ratchet up the war on Alzheimer's now. Once again, I have to ask the question, is this real life? This is a new patient. His wife just opened a salon down the street in Grand River. He's watched my lectures. He's been to some stuff. He races his granddaughter up a hill. He's 70 years old. And now he always beat his granddaughter up the hill. Now he's like, granddaughter's like 16. She beats the old man up the hill. His chest is kind of tight. A couple days later, he decides to go to the hospital. Goes in to get this chest figured out. They put 2 stents in his heart. A balloon, 2 stents. After running up a hill. Went 2 days later. I thought I should get checked out. No problem with the places. Went to the ER in Bloomfield. Heart cath, simple. His blood pressure runs 100/50. And his cholesterol's 100. So what do you think they did? They put him on blood pressure medication. 100. This was, and I just looked. Now, this is the medication he comes out of the hospital on. This gets better. And we're in room 3, so if you know my office, we're sitting in room 3. Kim had interviewed him, and she said, you should come and see what they did, too. So we walked into room 3. Blood work 2 weeks after the surgery. Now they got his cholesterol down to 65. I can't make this stuff up. This isn't real world. His HDL's 30. His LDL's 12. His platelets have dumped, and from watching the lecture, he's questioning the MD. He said, look, it's 65. I said, how do you feel? He said, I can't even get out of the chair. He said, I am too weak to stand up. And it gets better. Finally, he said, I'm still having the same indigestion that I went to the emergency room with. It was his stomach, not his heart. So he had to fight to them, and he said, why would you put me on blood pressure? This is the point of the story. Why would you put me on blood pressure for this? That's our protocol. This is what we do. That's the answer he got. But my cholesterol's 100. Why would you? Because this is what we do. There's no thinking that goes on. This is what, do you know how many years in school it takes to take your common sense out? You can sell mercury. You can sell medications. It's not easy to do this. This takes years to just keep beating on them till they make fun of the stuff you want to do for health. That's what they do, because they do it. It's unbelievable. This is not, David was right all along. This is not real. The girls will ask the patients, I'm taking calcium because my doctor told me to. So they go to Costco, they get the calcium out of the drum in the middle. It's oyster shell, it's eggshell, it's dolomite, coral calcium. I said, can you eat coral? No. I said, why do you want to? So all it does is calcify, increases your risk of heart attack by 30%. And they know that. You just might as well pour it right into your arteries. Tons of people are taking insoluble calcium because it's cheap. You don't take the cheap stuff. You're going to pay to get rid of the cheap stuff. Calcium deposits, which I don't have time to do. That's just this will be on YouTube eventually. There's going to be a new term coming out, orthorexia. The wrong way, extreme obsession with healthy eating, to believe that there's only one way that everybody has to eat. So they have a new name for this obsession with eating, orthorexia. Every time I had milk, my nose runs. Now, milk and ice cream are going to kill me, so I couldn't have milk or ice cream within a week of doing this, because I'll clear my throat worse than I do. Wheat takes out your stomach and gives you high blood pressure because of the gluten. Corn, this is the protein in corn that causes neurologic problems. And soy causes rashes, acne, rosacea. I did that sensitive 7. I wanted to see I'm trying to fine-tune my body at this age so that I can continue to live in a cartoon land and have it not affect me. sensitive 7. This is mine. Now, I have been on acidifiers forever. I take, Cal Ammo, apple cider vinegar in pill form. I take Phosfood, phosphoric acid, and a systemic acidifier. Now, because I know the whole world's trying to get alkaline, I'm not on the other side. This is what I've been digesting most of this stuff pretty well. I was shocked at how high the eggs were. Eggs were higher than anything this low. You can kind of skip. I have never had that peanut injection, as you can see. Eggs surprised me that they were the highest. I don't really go for eggs, but I'm not that big of a fan. So if you eat eggs once a week, big deal, it's fine. I'm not gonna get obsessed about it. Now, I'm not gonna explain this, but it's gonna be on the lecture just so that you can, a little history. Your NK cells, your mast cells, different things in your immune system. Here's your T cells. That's what they measure with the AIDS patients. Talking about your immune system. This is the panel you run on an AIDS patient. It's an expensive panel, and I don't want you to run this unless you're concerned about your immune system because it's too expensive. I wanted to see what does my immune system look like. Here's your T cells, your B cells, your natural killer cells. That's why I put IAG in my shake in the morning. Here's your thymus, your T cells, bone marrow. I pounded vitamin D. I took 30,000 units for about a week. I took 20,000 for 3 weeks. I've been doing 10,000, and on that March 17th test, I only got it up to 53. I had a lady today that was 135. I had to back. It's very tough to call this. You cannot predict. I've taken black people and pushed them over 100. I got a golf course superintendent who's my age. You know those professional construction workers whose faces look like scorched? They've been out in the sun so long. His vitamin D was 14. Spent his whole life on a golf course, 14. And if your vitamin D gets up high enough, I'm pushing for 80. If the vitamin D gets up high enough, you'll shut off about 17 different cancers. And again, your doctor told you to do what with the sun? Stay out of it. So I'm only at 53 now. I'm just trying to play with it to get it to 80, and it's been challenging to do. That's an immune panel. This is a great deal. You can go to LabCorp. You can fill this paperwork out at the office, $97. This is the best deal in town. That's better than $2,000, $3,000 blood test. There's your kidneys. Here's your uric acid. There's your gout and your sugar, your adrenal stuff, protein, digestion, platelets, thyroid panel. That's a great deal. Here's your liver enzymes. If you have trouble with your sugar, run this test at least once a year. It's $28. Tells you how well you've eaten over the last 2 to 3 months. That's the test the diabetics can't hide from you. Tells you how much sugar is attached to a red blood cell. This is how to read that, which really doesn't matter today. Dysinsulinism. These are the people turning diabetic. High glucose. My glucose started going up. That's why I retired from hockey, and I went back to hockey because my glucose was going up. My numbers were changing. I play 3 times a week on an aggressive men's league and a pickup league because I need to get, and people say to me, why am I, trouble with my sugar, my weight. I walk 9 miles a day in the office. And I still got to do this. 9 miles a day is what I'm used to. I have a blast on my hockey league because I'm the radical guy. I have the bunker. High glucose, low HDL, high LDL, triglycerides over the cholesterol, and high cortisol. That's what it's like turning diabetic. This is when you catch it. You got to get your grains, your fruit juice, all this kind of stuff out of you. You don't want to turn diabetic today. Everything's being held against you today. everything. White blood cells originate in the bone marrow. Different parts of your immune system that if I explain it, you'll never remember when you walk out, so I'm not. Increased lymphocytes, chronic virus and bacteria, decreased active viral and bacteria. I had a good increased lymphocyte today in a gal. We're trying to nail down what kind of virus she has, and it's been really challenging. Here's your parasite markers. I talked about this with Kelly today when we were putting this together. I said, Kelly, who do you remember from school? Remember the normal kids? No. Remember the weird kids. You want your kid to be Greg. I'm not going to use his last name because he might be alive. I'm in 5th grade, and all I remember about 5th grade is this poor guy, Greg, his last name starts with a U, scratched his butt all the time. He lived with his hands in his can. I never understood, what is this weird obsession you have? He had worms. Your kids are so I don't remember the normal kids. I remember him. You got to eat with that hand? Are you going to eat with that hand? You want to be known as the kid when they're 55? They remember him? And I see a ton of parasite people that this isn't even elevated yet. By the time that's elevated, you're all messed up. It's kind of funny. Now it sticks out in my head. I can picture him. I could spot him in a crowd at that age. And the other girl used to put glue all over her hand and eat it. Her name was Susan. She used to eat glue. And Liz always had to get a drink. Liz, you got to get a drink. I don't know what that meant. The sick kids stick out. I have 2 kids, 2 girls right now, 19 and 22, that have Hep C from shooting up heroin. A bunch of kids are doing heroin now. You know why? It's $5. It's $5 a dose. You can pick up bottles right now. Who's in charge of the heroin fields? Where's all the heroin come from? Afghanistan.
Poppy Bush.
Huh. The Detroit Free Press put an article out, $5 a dose. I couldn't believe it. When I was growing up, you had to really steal some stuff. If you're going to, you had to $300-400 a day. Well, whoever's in charge of the heroin market, they're ruining our children. They're having town hall meetings in Pinckney. They're having meetings in these, because kids are overdosing everywhere. Everywhere. Because it's cheap. It's cheap. I said, this lady, one of my patients, oh boy, I shouldn't, her kid, 19 years old, his friends carried him into, I think, Henry Ford emergency room, threw him in a wheelchair and bolted. He was dead. That was one of my patients. And I had the sisters in crying, why is he doing this? I said, it's cheaper than a case of beer. It's cheaper than a case of beer. So this poor girl, this is her liver enzymes with Hep C, some very aggressive liver support. This was cool. From the 19th to 3.5, here's her liver enzymes, 152 to 44, 178 to 56, 107. Parents were very impressed. I got a bunch of these right now. Autoimmune hepatitis, 32 years old, AST, ALT. Now, people come in with autoimmune hepatitis, which I'm suspicious of. I had a 70-year-old woman come in. She's a nurse. She said, I have autoimmune hepatitis. Well, I have trouble with autoimmune diseases because I don't think the body wants to attack itself unless something was done to it first. I said, all right, let's go over your vaccine history. She said, well, in 1987, I had a horrible reaction to hepatitis B vaccine in nursing school. 87, 97, 2007, I think this is about 2 years ago, it took 30 years for her liver to do that. I believe this was a vaccine reaction. This is a 32-year-old. Liver enzymes were 152. They were up this high They're down back in range. I got to keep my foot on that liver because it tries to act up if you let it go. But this has been a complete home run on this poor girl. She's got 3 kids. The birth control pill drove these liver enzymes up. This patient yelled at me because, how come you never use my slide? Here's Tylenol and alcohol. Here's your veteran. Here's your veteran. Pile of drugs this long. Tylenol and alcohol till his liver, they said your liver's dead. Hepatitis A, B, and C. And you know, he was in, I don't know, last week. His liver enzymes are still here. And his doctor, you know, said your liver's gone from dead to being completely alive. On this guy, I think, 5 times 14, 90 grams of silymarin. And 90,000 milligrams to regenerate that liver. I walked into the room. First question I asked this 78-year-old woman, all this, where'd you retire from? Government. It's either the big 3, government, or teachers. When they're on that many medications, somebody else is paying for it. She's in stage 4 kidney failure, and she says from atenolol and Actonel. Okay. There's your kidney markers, creatinine and BUN. Creatinine and BUN. And I said to her, are you still taking those? And what do you think she said? Yes. Why? Because they didn't tell me to stop. So every time I tried to, all right, I guess she's on dialysis now. All these medications, plus she's on 14 medications, which is beyond the nursing home thing. I'm just about done with this. This poor guy's out in the crowd. They kept pumping up his medications to get his blood pressure under control. And when they had his blood pressure under control where they wanted it, his glucose was 222. His BUN, he was in total kidney failure, BUN 86. This is from his medication. Now his blood pressure was happy. His kidneys were just groaning under it. So from 726 to 67, I said, look, there's a couple of medications you got to stop, and there's some supplements you got to take. These medications, beta blockers and water pills, are turning you diabetic. Beta blockers and water pills. So watching his glucose went from 222 to 133. What is that, 2 weeks? His BUN went from 86 to 28. Your people are being pushed off the cliff with your medications, but it's a free cliff, so you're happy. This is a catastrophe. This is very important, very, 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 very. I just had a lady had a heart dye study, which was perfectly normal. This lady came in. I got her before and after kidney numbers, and her kidneys are completely out of range, way out of range. I looked at her. I said, what did you do? And she said, oh, Dr. Tent, I had a weak moment. I had a dye study on my heart. This will trash your kidneys. It will trash your kidneys. And there's a way to protect it, which nobody tells you. And I talked to an old retired nurse. Why are my patients coming in with their kidneys trashed from the dye? That's an acetylcholine mucomist. If your doctor has you take that, it's acetylcysteine. For 2 or 3 days, your kidneys are completely protected, and they never tell you that. And it took me a long time to find out why are these patients' kidneys going south from a dye study. Mucomist. This will save a ton of people's kidneys. This lady's son is a big prosecuting attorney. Her BUN's completely out of range. Her ratio's terrible. She's got blood, bacteria, leukocytes, red blood cells, and white blood cells on her. She came in, this is about 2 weeks ago. This was her blood work she laid in front of me. The MD said, it's fine, I'll see you in 6 months. It's a complete kidney disaster. That's fine. Your kids can have their growth panels checked. IGF factor 1, there's the range for a kid. I have a few children who aren't growing fast enough. So you can run this blood test, you do some support, and they'll start growing. Support the pituitary. So if your kids aren't growing fast enough, get that IGF factor 1 test, and you can start to see them, watch them. That was that twin, wasn't it? That was that twin. They bring me, this is a short story, they bring me these twins.
They look alike.
Yeah, there's a boy and a girl. That was the boy. I swear that was that. The boy's like this and the girl's like this. They've been to U of M, Cleveland. Huh?
We've got identical twins, and that's exactly what's going on. Exactly.
Am I making this up?
Yep. No.
Okay, just like this. How many doctors have you been to?
They've been to Michigan.
U of M.
Did nothing.
Okay.
So they'll catch up.
Okay, so I'm sitting there with those kids just like this, and she'd been everywhere with these kids. And I walked in the room, that was him. And I said to the mother, so they're down to me now, which you know it's got to be bad. So I look at these. I walked in, I'm looking at, and the kid, the boy, is the patient, not the girl. The girl's in the chair playing whatever she's playing with. And so this kid's big smile on his face. So you've been all over the country for this. Yeah, we've been everywhere. I said, he's a runt. He didn't have enough minerals for 2 kids. She said, that's what it is? I said, yes. She took all the nutrition. He missed it. That's it. Done. So I checked his growth thing, supported his pituitary. He's starting to grow now. I have patients come in, I'm carrying twins. Are you taking your supplements? No. You're going to want to take this. You better support your... I've had to argue with women to take their supplements because Blue Cross didn't pay for that, and they're going to get stuck with a runt. I said, he's the runt. I've looked at x-rays on people. All right, your x-rays are a mess. How many kids in your family? 8. Which one were you? Number 8. Look at this. Look at the defects all over this. You got a spina bifida, you got a birth defect, you got an accessory articulation. This vertebrae is different than that when you're vertebrated. I said, your mother was cooked by the time you came along. A runt. I see these runts all the time. Clotting factors, homocysteine. My son's best friend's dad died. So, dropped dead at Planet Fitness. The whole family croaks before 60. They all work in hospitals. I run the panel on the 19-year-old kid. There's what's killing the entire family. The MD for the family looked at this clotting factor that killed the entire family and wrote perfect at the bottom. Is this real life? Is this real life? I'm just about done. My best patient, Lisa, 59 years old. I mean, she worked at this. She took the pills, she did the exercise, she ate meat and vegetables, cut out the grains, the sugars, the fruits, and the carbs, took her glucose from 324 down to 110, lost 35 pounds, exercised. I did a third of this. She did 2/3 of this. Phase 1 diet, meat and protein, green vegetables, nuts, seeds, and cold fats. There's your diabetic diet. You will lose weight on that diet. I guarantee you'll lose weight in that diet, and your numbers will change. Okay. I will be back in August with an interesting mineral lecture. Thank you for your attention, and I'll see you in August.